So, have you ever wondered what it really takes to be that person in the medical office? You know, the one who's the first friendly face a patient sees and the doctor's absolute right hand? Well, today we're going to break down exactly what makes a great clinical medical assistant, or CMA. Let's get right into it.
All right, here's our game plan. We'll start by looking at why they're the MVP of modern healthcare. Then we'll dive deep into the four pillars of the profession: the professional foundation, the legal and ethical stuff, the hands-on clinical skills, and the administrative backbone that holds it all together. And finally, we'll see how all of this creates a true certified professional.
So, let's start with a big picture. In today's crazy, fast-paced world of healthcare, the clinical medical assistant is, without a doubt, the most valuable player. Seriously, they're like the indispensable multi-tool for any medical office.
I mean, think about it. They are the ultimate jugglers. One minute, they're calmly taking a patient's vital signs, and literally the next, they're managing complex medical records or scheduling critical appointments. It's this amazing blend of clinical skill and administrative know-how that makes them so incredibly vital to the whole team. Okay, so what is this all built on? That brings us right to our very first pillar, your professional foundation. And this isn't about what you do, it's all about how you do it. This is the absolute bedrock of your career. It's all about character, communication, and of course, compassion. And these traits, they are completely non-negotiable. Dependability isn't just showing up on time, it's being the person the entire team knows they can rely on no matter what. Honesty means you know your limits and you never, ever step outside your scope of practice. And tolerance and empathy, you've got to have those to build real trust with patients from every single walk of life. This quote right here just nails it. It really gets to the heart of the ethical weight of this job. See, it's not just a job, it's a duty. This deep commitment to right conduct is all about meeting the expectations of patients who are, let's be honest, often feeling pretty vulnerable. That is a huge responsibility. And that responsibility is guided by our second pillar, the legal and ethical compass. Every single thing a CMA does is governed by a super strict set of rules that are there to protect both the patient and the professional. You gotta know the rules of the road. First up, the big one, HIPAA. We've all heard of it, right? But for a CMA, it's part of their daily world. This federal law is basically the guardian of patient privacy. It means that anything a patient shares is kept under lock and key. And it's the CMA's job to make sure computer screens are angled away, conversations are quiet, and records are totally secure. Then you've got OSHA. Now, if HIPAA protects the patient's information, OSHA is all about protecting the healthcare worker's safety. Its standards, especially the big one on bloodborne pathogens, dictate everything from wearing the right protective gear to how you dispose of needles. It's all about making sure the work environment is safe for everyone. And when it comes to any kind of lab testing, that's where CLIA steps in. These are federal rules that make sure any test a CMA performs, even something that seems simple like a blood sugar check, meets really high standards for accuracy. It means quality control isn't just a suggestion, it's the law. And finally, a CMA has to be an absolute expert on consent. And let me tell you, it's not a one-size-fits-all thing. You have implied consent, that's when a patient just holds out their arm for a blood draw. Then there's express consent, which is a clear yes. But informed consent, that's the most serious one. It means the patient has to understand all the risks and options before signing off on a procedure. So, all that legal stuff provides the framework for our third pillar, mastering the hands-on clinical skills. This is where the rubber meets the road, you know? It's the very heart of patient care. And it all kicks off with the patient intake. Think about this. Before the doctor even walks into the room, the CMA has already gathered a ton of vital information. They confirm who the patient is with 2 different identifiers, and then they carefully document their history, meds, allergies, and vital signs. This whole process lays the foundation for a good diagnosis. Okay, here's a pop quiz for you. When drawing blood, a CMA might use a bunch of different colored tubes. But did you know there's a super strict order they have to follow? Why do you think the order of that draw matters so much? The answer? It is all about preventing cross-contamination. See, each of those tubes has different additives inside. If you draw them in the wrong order, you could accidentally mix additives, which would totally mess up the test results. Following this exact order is the only way to make sure every single sample is accurate. And you see that same kind of precision in other procedures too, like when they're performing an ECG. Look at these exact placements for the leads. There is absolutely no room for guesswork here. If a lead is off by even a centimeter, it could change the whole reading and maybe even lead to a wrong diagnosis about the heart's activity. CMAs are also right there assisting providers with minor procedures, like taking out stitches. It's a really careful step-by-step process. From cleaning the area to gently removing each suture, the CMA's steady hand and focus on detail helps make sure the procedure is safe and that the patient heals up properly. Okay, now for every single clinical task, there is an administrative one that's holding it all together. And that brings us to our fourth and final pillar, the administrative backbone. This is what keeps the entire office running like a well-oiled machine. A huge piece of this is managing medical records. And this is a big deal because it directly affects patient safety. A CMA has to be totally fluent in whatever charting system the office uses. A problem-oriented record, or POLMer, organizes everything around a patient's specific issues. A source-oriented record, or SOMAR, on the other hand, files info based on where it came from, like putting all the lab results together in one spot. And these administrative duties are so much more than just filing. They're incredibly diverse. We're talking about everything from setting the tone for the entire visit at the front desk to managing those complex records we just talked about. They handle tricky billing and insurance codes, and they even manage office supplies to make sure the clinical team has what it needs. They are truly the hub of the entire office. So when you put all of that together, what do you actually get? You get a certified professional, someone whose job is so much more than just a list of skills. It's a genuine commitment to caring for people. We've seen how these four pillars, the professional foundation, that legal and ethical compass, the mastery of clinical skills, and a strong administrative backbone, all come together to create a CMA who is competent, compassionate, and absolutely essential to the healthcare team. It's a career that really demands a unique mix of heart, mind, and hands. It's built on compassion, on technical skill, and on an integrity that never wavers. So, now that you've seen the foundation, the only question left is this: are you ready to build on it?